focus on the things we're grateful for. The simple note of thanks we recently received from a Canadian reminds us of how far we have come. I received the vaccine this week, and I am amazed that this time last year we were struggling to understand this virus, and now we are vaccinating against it. Canadians across the country have been channeling this kind of positive energy to help others. One example is vaccinehunters.ca. This community group has banded together to supplement COVID-19 vaccination initiatives by aggregating up-to-date information on vaccine availability on their websites and social media platforms. They are helping eligible Canadians find vaccination clinics and pharmacies where they can book an appointment. Their website also provides links to other local volunteer organizations, such as Pink Cars, who are helping seniors 70 years or older in the York region with transportation to get to their COVID-19 vaccine appointments. Similarly, vacstat.ca helps Quebecers find the same day or next day COVID-19 vaccine appointments through their website. Another important volunteer effort is dispelling misinformation to support informed and confident decisions on vaccination. Teams of independent scientists, health professionals, and science communicators have come together in collectives such as Science Up First and the Canadian Muslim COVID-19 Task Force to make science more accessible across platforms, cultures, and languages. Though this may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated by working online, over the phone, or in other ways to help others. Working together, we can bring the infection rate down and keep it down until vaccines have rolled out across the Canadian population. This is how we can all build a vaccine bridge that takes us to greater safety and back to the things we have missed so much. Thank you.
Merci. Bonjour à toutes et à tous.
Thank you. Hello, everyone. This week is National Volunteer Week in Canada, and we're reminded, especially during these difficult times, of how important it is to support each other, to lend a hand when you can, and to know you are not alone when you need help. To date, over 1,139,000 cases of COVID-19, including over 23,700 deaths, have been reported in Canada. Over the past week, an average of over 8,640 new cases were reported daily. During the same time, the number of people experiencing severe and critical illness continued to rise. On average, over 3,970 people with COVID-19 were being treated in our hospitals each day, including 1,200 people being treated in intensive care units, representing a 24% and a 21% increase, respectively, compared to the prior week. An average of 46 deaths were reported daily over the past week, which is 28% higher than the week prior. There are over 70,300 variant of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these cases. To tackle this wave, we need to use all available tools. That means keeping up with individual precautions and public health measures in your area, as well as deploying all safe and effective vaccines in optimal ways. Vaccination is fundamental to ending the pandemic, and we encourage all Canadians to get vaccinated to protect themselves and their communities from illness, hospitalizations, and deaths from COVID-19. This week, we marked the important milestone of over 10 million doses of COVID-19 vaccine having been administered in Canada. We know there is still a way to go, but we continue to gather strength from good news and a focus on the things we're grateful for. This simple note of thanks we recently received from a Canadian reminds us how far we have come. I received the vaccine this week, And I'm amazed that this time last year, we were struggling to understand this virus, and now we are vaccinating against it. Canadians across the country have been channeling this kind of positive energy to help others. One example is Vaccinehunters.ca. This community group has banded together to supplement COVID-19 vaccination initiatives by aggregating up-to-date information on vaccine availability on their website and social media platforms. They are helping eligible Canadians find vaccination clinics and pharmacies where they can book an appointment. Their website also provides links to other local volunteer organizations, such as Pink Cars, who are helping seniors 70 years or older in the York region with transportation to get to their COVID-19 vaccination appointments. Similarly, vaxstat.ca helps Quebecers find same-day or next-day COVID-19 vaccine appointments through their website. Another important volunteer effort is dispelling misinformation to support informed and confident decisions on vaccination. Teams of independent scientists, health professionals, and science communicators have come together in collectives, such as Science Up First and the Canadian Muslim COVID-19 Task Force, to make science more accessible across platforms, cultures, and languages. Though it may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated by working online, over the phone, or in other ways to help others. Working together, we can bring the infection rate down and keep it down until vaccines have rolled out across the entire Canadian population. This is how we can all build the vaccines bridge that takes us to greater safety and back to the things we have missed so much. Thank you.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking your questions in both official languages, and we ask that you limit yourself to one question and only one follow-up. Comme d'habitude, veuillez vous nommer et nous dire quel média vous représentez. Nous vous demandons de vous limiter à une question et seulement une question de suivi, et vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Over to you, Mathieu.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question est de Philippe Vincent Foisy de Radio-Canada.
The first question is from Radio-Canada. Please go ahead. Question. Yes, I have a question in French as to NACI, the NACI recommendations, the National Advisory Council on Immunization. There's supposed to be a press conference. There was supposed to be a press conference, but it was canceled. Why was the NACI press conference canceled? Don't you think that will only add to people's fears and lack of confidence about some vaccines? Can you please let us know why they decided to delay the recommendations, and what do you think about the fact that it's now being, the Astrazeneca is now being given to ages 40 and up? Answer. Thank you for the question. This is Dr. Njoo. Yes, it's always something that is a current challenge. NACI, the National Advisory Council on Immunization, is receiving and analyzing all the updated evidence, which is always a challenge because if we keep waiting for all the data and studies being done across the world and here in Canada, then we're criticized for being too slow. But if we make a decision too precipitously and then the next day some further data surfaces, we may be criticized for acting too quickly. So I understand that they are currently analyzing very important data, and including the data that's available here in Canada, and weighing the benefits and risks. And so they may be considering adjusting their recommendations further. So, but in the end, this committee continues to be sensitive to providing recommendations with their own expertise, based on their own expertise for provinces and territories to consider in determining their own vaccination programs, because really, ultimately, the provinces and territories are responsible for the vaccine rollout. And a few provinces have already made some changes. And that is because we had a meeting, we had a teleconference last weekend with the committee, and we did discuss the latest available data and evidence. And certain provinces and territories have already begun to adapt their vaccination programs as a consequence. And now the committee continues to analyze even more recent data. So I believe that soon they will be making another statement with possibly another update, more updated recommendations. I believe that people should feel confident, and I think that this will help bolster the entire Canadian population's confidence in this vaccine. We can see how seriously the committee takes its work and is constantly analyzing updated data and evidence and adjusting its recommendations as the science evolves. Thank you.
Theresa, could I...
Can you just repeat that in English, please? Yes, go ahead, Dr. Tan.
Yes, I was going to just repeat that in English because I think everybody seems to have an interest on this question, which is about the National Advisory Committee on Immunization and why they didn't do their technical briefing yesterday. So as Dr. Njoo had indicated, the committee, the National Advisory Committee on Immunization, was about to release their latest recommendations, an update to the recommendations for the use of Astrazeneca vaccine in light of the rare reports of a serious blood clotting and low platelets disorder. And just to reassure everyone that it is because they received some new data that they thought was pertinent in terms of analyzing the impact of the COVID-19 on the population in light of variants of concern, and not because of any changes in the data already existing for the thrombosis disorder itself. That remains a rare disorder, and the rates that they were looking at hasn't changed. It's more when you're balancing the benefit and risk analysis, it's important to look at the benefit of the vaccinating individuals given the increase in the epidemic activity in many parts of the country. And so that is what they're working on, just to validate the information that they had before with the new data. But as Dr. Njoo said, the data is always undergoing evolution, so they're going to take this final look, and then they'll be out with the update shortly. We did have a meeting with all the chief medical officers and the National Advisory Committee on Immunization over the weekend, so they do have the analysis at hand as they were making their decisions that you have seen announced over the last few days.
Thank you, Dr. PV. Question suivie?
Do you have a follow-up question? Yes, question. We see that certain flights coming in from Brazil are still being accepted in Canada, as well as from India. At what point will Health Canada be concerned by the fact that people can continue to enter the country carrying variants from countries in which the situation is not at all under control? How much is this of concern? It seems, too, that the follow-up measures are not properly implemented. So is Health Canada concerned by the fact that we're still seeing flights coming in from countries in which variants of concern come? Answer. This This is Dr. Njoo. Perhaps I can begin to answer. Well, it's always a concern that we keep an eye on. We're keeping an eye on what's going on across the whole world and deciding what we do about our borders. Because protecting Canadians' health is always our priority. I think that with the measures currently in place at our borders, we are currently requiring that any visitor arriving in Canada undergo a test before they arrive in Canada and then take another test once they arrive in Canada, and another one 10 days later, to ensure that they are not infected. And of course, there is the 14-day mandatory quarantine period. So I think with all of those measures taken together, they are amongst the most rigorous measures and requirements in the world. But of course, we're always watching what's going on with the emergence of these new variants. You mentioned Brazil and India, and there may be other countries further down the road. I think it's always important to maintain a global approach. And once new variants are identified, of course, it's like chasing your own tail. The virus continuously mutates, but we're always open to looking at the measures taken at our borders, and we continue to analyze and collect data and evidence from here and from other countries. But I think it's important to understand that it's not just about the variants at our own borders and what's going on in other countries, because we know that with viruses it's practically impossible to prevent new variants from arriving here in Canada. Look what's going on with the variant identified in the United Kingdom. It's very important to figure out what it is we're doing inside our country once these new variants have emerged here. It's very important to do contact tracing and lots of testing. There are many things that we must continue to do here in Canada, besides just focusing on what's going on at the border. Thank you.
Merci, Dr. Njoo.
Thank you, Dr. Njoo.
Well, maybe, sorry, it's Theresa Tam. I'll just repeat that in English because I think there'll be another question, a similar question coming up about the border measures and what we're detecting and what might be some of the concerns. So, of course, the virus globally is undergoing evolution, and there are many different mutations and changes in the virus, particularly in countries that have a lot of cases, of course. That gives the virus more chance to do that mutation. There's been several that's been identified as variants of concerns that you've all heard about, the B117, B1351, and the P1, which was originating from Brazil. So given that situation, the strategy for Canada was to add more layers of protection for every country. So the pre-boarding test, the post-arrival 2 tests, and of course our foundation, which is the 14-day quarantine, trying to add more reinforcements, the government authorized accommodation to await that first test, and just engaging more people on the ground, ensure compliance, were all put together at the time when the UK first notified of a variant of concern. There are many variants which are under monitoring, which we call variants of interest, which includes the variant that has been reported from India. We don't understand enough about it, but there are mutations on it that are similar to other variants of concern, which means that, of course, we need to look at that data very carefully, but there's not a lot of information that's coming out of India at the moment. But so these are universal measures that we've been layering upon at the border. The testing has been very helpful. So we've been detecting test positive travelers, as well as sequencing every one of them to look at what variants might be coming across the border. And that will help inform us of what further needs to be done. For Brazil, there are low numbers of travelers. The P1 variant has been picked up through border screening. But not just from Brazil, though, because we know that it's actually in 50, probably now, somewhere between 40 and 50 other countries. So country-specific targeted measures can only go so far. It's actually the broader application of measures to all countries that Canada has been focused on. India, we will be doing further analysis because it's an emerging situation, not just because of the variant of interest at this point, but because they have unfortunately, a very massive resurgence in that country, and we'll be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps. Thank you.
Thank you, doctors. Now we'll go to the next question. Operator.
Merci. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi, thank you for taking my question. Nearly 1 million people in Canada now have nearly 1 million Canadians have now been fully vaccinated, and many of those are high-risk seniors living in congregate care. The CDC eased public health restrictions for fully vaccinated people weeks ago. Why hasn't Canada changed the rules, especially when it comes to seniors who are essentially still locked up in their long-term care homes?
So yes, we've had 10 million, close to 10,500,000 individuals vaccinated, at least for the first dose. And we do know that some of the long-term care facility residents are now receiving their second dose. So that's great news. The other great news, of course, is in the seniors coming down and the number of long-term care facility outbreaks coming down, and even the ones having outbreaks, there are fewer cases. So that vaccine effectiveness is being monitored in key jurisdictions with researchers and demonstrating the effectiveness of that initial dose, but coming back with that second dose. So I think that's important. And to change policy, I do think that the long-term care facilities are the one area where you will see that policy shift beginning, so that there will be more ability for seniors in those homes to return back to some of the normalities and having more visitors, although the visitors, of course, may not be vaccinated at this point in time. But all of the precautions still has to be taken. But provinces are in charge of those policies, and you will begin to see them using the data at hand and what they're seeing on the ground in order to adjust those policies. But of course, outside the doors of the long-term care facilities, we have a ways to go. Some of the senior age groups haven't completed the vaccination, although those seem to be going well. And healthcare workers, we want to make sure they're all provided with a vaccine. I think the uptake's really good too in healthcare workers, close to 90% with at least one dose. But just a reminder that, of course, Canada's strategy is getting one dose to everyone as fast as possible on all the eligible age groups and coming back with that second dose. We are taking a community-based approach where individuals are protecting themselves with that very effective first dose, but also to generate the community level of I protect you, you protect me kind of concept in direct protection, so that everyone can benefit from increased social and connections as a result of that community-based, population health-based approach. But I do think that, of course, we'll all begin to adjust those measures. But if you look at the United Kingdom being the country closest to us with their strategy of the one dose with stretch interval, they are being very careful. You need to drive down that epidemic So this third wave needs to come under control, and then we need to be able to ease those measures very slowly while the vaccine coverage is increasing.
Okay, well, that leads into my next question. My follow-up is that a chart in the budget suggests about 80% of Canadians will have at least one dose by Canada Day, with the economy projected to pick up drastically starting very shortly after. Will a strong majority of Canadians only getting one shot be enough to ease restrictions across the country?
So what eases restrictions across the country is getting the epidemic under control, the pandemic in Canada under control. That has always been the driver of easing measures. Do not ease measures rapidly on the way down. Like, this is what happened in that second wave. You ease, partially down the epidemic curve, the virus will come back very quickly. With vaccines on board, the chances of that may be diminished, but it's not, completely eliminated. And so getting that second dose is very important to ensure that when we relax measures, you're not back to sort of the beginning of trying to get the virus under control. It has to be both public health measures and the vaccine right now to plank the curve again. That's what's going to let us have more relaxation in those restrictive public health measures. So, of course, we want to track this as we go along, but vaccines gives us a much better chance of being able to do that. So that's why it's very important to get vaccinated.
Yeah, it's Dr. You just said to underline what Dr. Tam said. I think we've said it several times, myself included, that we should be following the data and not just dates. So vaccination, certainly vaccines are a very important tool, very key in terms of, as you say, trying to get towards a sort of a future where we might be relaxing some restrictions, but certainly the public health measures are key. Certainly, look what's happening now in Ontario. It's not going to be vaccines alone that solve the current situation in Ontario. You need to be very strict with the public health measures, and I would say that's also twofold. I think at an individual level, people really have to think about what activities they're undertaking. Are they really just the essential activities, going out for groceries and so on, or are there still some discretionary activities that they really should not be doing, like traveling for a vacation or going for a recreational sort of a pleasure activities, even outside of their own community. So that's something to consider. And then, of course, at the population level with governments and so on, it's a type of restrictions that really try to decrease mobility and decrease the types of interactions, the number of interactions people have. And I think to support, what was put forward by the Science Advisory Table in Ontario, it's not just a matter of saying people, decrease your contacts. There are many people, the essential workers, that are not able to, for lots of reasons we all know about, in terms of lack of sick days, other social supports, and so on. So I think to get to that point, it's very important to have those supports as well, so that all Canadians can hopefully, in a sense, feel protected and have the measures in place that they can also practice personally, and also at a population level of the public health measures as we keep rolling out the vaccines. Thank you.
Thank you, doctors. We will move to the next question. Prochaine question, opérateur.
Merci. La prochaine question est de Raymond Filion.
Next question, TVA. Please go ahead. Thank you. Dr. Njoo, just to come back to India and its variants. If we suspend flights, why aren't we considering suspending flights from India as we did in the spring or last year for United Kingdom when its variants emerged? Answer, just briefly, even the Prime Minister has stated that all options remain on the table. I think that we do have to perform a proper analysis. We now have experience with what happened with the UK variants, as you said. So after that, we implemented further measures at the border with pre-testing, pre-arrival testing, and arrival testing, as well as the 14-day mandatory quarantine period. So we have to look at measures that are already in place today, see how effective those measures are, see if they need to be adjusted. And as Dr. Tam and I have stated, it may be more effective to adopt a global approach rather than focusing on one country at a time in ensuring safe borders. But if there are other measures we can implement quickly to manage a situation, for example, the situation in India, we're always open to that possibility, and our conversations, our discussions continue, as do our analyses of current risks. As a follow-up question, in your opinion, how important it is to prohibit movements between various regions in Canada or provinces, especially given the new variants? Well, I think that is a current issue, along with provinces and territories. Even in British Columbia, I believe, we have advised or encouraged Canadians, or they have encouraged Canadians to stay at home, to remain in their own region. Of course, it's always important to go outside and get some fresh air, but to stay in your own community, not even to move around inside your region. For example, in British Columbia, if you're in Vancouver, residents of Vancouver are being discouraged to go to Whistler, even though one could say that it's in the same region or the same area, and I think the same principle applies across the country. People are being discouraged from traveling between provinces. As we saw, many Canadians traveled to other provinces to go ski and have other types of holidays, and now we're saying, look, with these new variants, it's really important. We can see what's going on now in Ontario. It's a real crisis. It's a public health crisis and a healthcare crisis. We really need to learn from what's happened and what's going on right now in Ontario. People just need to stay at home. It's quite simple. Thank you, Dr. Njoo.
Thank you, merci. The next question is from Evan Dyer of CBC News. Your line is open. Please go ahead.
Hello, thanks for taking my question. I'd like to ask, you mentioned that you're currently doing a risk analysis on the situation in India. Do you know when that might be ready?
I can't comment on that. We are always looking at the data, including who is testing positive coming into Canada, for example, and we have to get as much information as possible, for example, on that variant of interest, and which is not yet a variant of concern. So lots of work is being done in multiple departments to look at that situation. But as I said, that it can be one country one day, another day. So it is very important that we have been taking these more broad measures for any traveler.
And just to follow up on that, I know that India and Brazil both have variants, but are very different countries in a way. I mean, India's been a kind of a model citizen, sharing vaccines with other countries. Brazil, I think, has been widely seen as a very irresponsible government, not taking COVID seriously. You were talking about the idea of, I protect you, you protect me, and we do penalize individuals who don't take COVID seriously in Canada. Do you think that as this pandemic develops and as we start to emerge from it, there will be a place for pressure or action against countries that don't appear to be taking COVID seriously, continue to spin off variants that threaten other countries' vaccination campaigns?
Well, I think, internationally, in many ways, we are in it together. And as long as countries are not able to control what's happening domestically, it will affect everyone else. But we have to control what we can control, which is the measures that we've sort of put in place. To the many layers, we kind of kept adding some more. But the testing regime, I think, is really important so that we can manage the individuals coming into Canada and reduce the risk of the variants of concern. I mean, I think if you look back at the statistics, the number of travelers have already been significantly reduced compared to, of course, pre-pandemic times. But these layers of measures are meant to help us reduce that spread. No border measures are completely 100% effective, of course. Every layer adds another layer of protection. I do think that it is important, wherever we can, to assist others so that it has a benefit at the other end for Canadians and people who are in this country as well. So I think it takes so many layers of discourse and arrangements, some of which is not really in the agency's area of influence. But I think the whole of government and our ministers are, of course, looking at that in terms of other countries. Anyways, I think maybe I'll leave it at that. Thank you. But Brazil and India are actually very different on many other fronts. There are many more connections with India to Canada than there is to Brazil for all sorts of reasons, and many different types of travelers and many Canadians who are in India, and there's traffic from that perspective as well. So there's many considerations before any other actions are taken.
Thank you. Operator, next question. Prochaine question.
Merci. La prochaine question est de Boris Proux du Devoir.
Next question from Le Devoir. Please go ahead. Hello, I'd like to come back to an earlier question about the National Advisory Council on Immunizations, NACI. Could you summarize what they're working on currently? We would like to know what's going on. We understand that they were planning a press conference yesterday, but they then canceled it because they received new information. Just when provinces have dropped the eligibility age to 40. Can you tell us anything more about that? This is Dr. Njoo. Perhaps I can begin to answer. Yes, I can tell you what's gone on this week. We had a teleconference with the National Advisory Council on Immunizations, the NACI, and also with the Special Advisory Committee of Chief Public Health Officers of the provinces and territories. And based on those discussions and the evidence and data made by NACI the previous weekend, that provinces and territories announced the new guidelines for eligibility for this vaccine over the last week. Now, NACI is receiving further data and evidence that it's analyzing. I don't think anything's changed much. It's just that they always want to keep up to date, look at all of the benefits for the whole of our population, taking epidemiology into consideration per region, for example. There are many factors to consider. And of course, we all impatiently await any further statements, updates, or presentations by the Advisory Council following their analysis of new evidence and data. I don't think that the provinces and territories' recommendations will change, however, because they've already received the important analysis of the data by NACI and adjusted their eligibility guidelines. Look, this is an effective and safe vaccine. It has been approved by Health Canada. And it's very important during this third wave in many provinces to use all available tools as quickly as possible and vaccinate as many Canadians as quickly as possible. So I think the fact that provinces, as you know, have already adjusted the eligibility age for Astrazeneca is a very important fact. We will continue to follow the evidence and trust the science and adjust measures as required. Follow-up question. Yes, I think earlier this week you answered a question about women that seem more affected by these rare cases of blood clots. I'd like to know if, as evidence and data accumulate, you might consider recommending one vaccine over another by gender. One for men, one for women in some cases. This is Dr. Njoo again, answer. Look, I want to clarify that this is an extremely rare event. Even the physiology as to how it happens, this extremely rare event, such as blood clots, may be different if we compare it to other risks. For women, perhaps, women on taking contraception, for example. The first cases that were reported may have created a certain bias because we began vaccinating healthcare workers at the beginning because that's a priority group. We know that among that priority group is largely made up of women. So that has to be taken into account as well. So far, given all the data and evidence received, we have not found that there is a real difference. And we really cannot say that women are at greater risk than men, which is why Health Canada, as well as all the other regulatory bodies across the world, did not recommend that this vaccine only be given to men. It's not really an increased risk for women.
I'll just clarify that point as well in English, that there is no specific risk factors for the thrombosis, thromboembolic syndrome with low platelets. It's a very specific underlying mechanism that is driving that rare event. There is no sex or age risk factors for that condition. How provinces in deciding the program and the National Advisory Committee on Immunization comes with a recommendation according to age groups is actually based on the impact of COVID on different age groups, where you get a much more severe outcomes in the older age groups. It's not because there's an underlying risk factor that is currently evident on the thrombotic event.
Merci beaucoup. Operator, next question. Prochaine question.
Thank you. The next question is from Mia Rapson of the Canadian Press. Your line is open. Please go ahead.
Yeah, I'm just wondering, Dr. Tam, if you could give us some more information about exactly what data was provided to NACI, what study. You said it wasn't about the blood clots, but more about the variants. I'm just wondering if you could tell Canadians what specifically they were given new data on that sort of pushed this back, not just a little bit, but by several days. And also, how relevant has NACI made itself in a pandemic when maybe the model isn't set up to make decisions as quickly as we need them? Do you think that this model is actually working in a pandemic?
Well, science is always evolving and is evolving fast, so it is quite challenging, and I can guarantee that everyone from the regulator to NACI to our epidemiologists are working continuously. So you're right in that you can't just keep shifting recommendations all the time. You do have to have analysis that you can settle on for now. Obviously, if there's any significant changes, the committee will go back and have another look. So I don't have all the details. All I was told is actually about the impact of COVID-19, including the emerging variants of concerns, impact on severe outcomes. So that data has to come from the provinces and territories. And as they provided some new information, particularly and on that front, I think that's what they're looking at. And it may not change anything in terms of what they've already come down to. I'm not sure. That is still in progress. And maybe I can leave it at that. But it is challenging for everyone in terms of the policy space for public health. But we want to, I think uppermost in everybody's minds right now is that we wanted to provide the best advice because it's about safety. And therefore, Canadians need to be reassured that all of these checks and balances are in place so that they can make those decisions to get themselves vaccinated.
Thank you. And Dr. Njoo, I understand that there was a meeting of the chief medical officers yesterday afternoon. The last time you met, or at least just discussed the Astrazeneca issue, it was decided that every province would follow the recommendation not to give it to people under 55. Now we have seen provinces sort of jump out and make different decisions. How hard is it for Canadians to understand what is happening or what they should do when the provinces aren't aligned, we don't have information from NACI, and how hard do you think this is going to be in terms of vaccine hesitancy?
Well, thank you very much. Multiple questions there. First of all, I would say that, it's never a question of everyone, quote, being in lockstep. As NACI has indicated, and I think I've sort of said as well, is that their recommendations that they put forward takes into account sort of a broader public health perspective compared to the regulator, which looks at a product on a one-by-one basis, looking at the overall sort of benefits versus the risks. So with respect to NACI, that broader public health perspective takes into account epidemiology, looking at other vaccines available, and so on and so forth. So taking that now a step further, as you mentioned, with the provinces and territories, at a certain point in time, based on their understanding, their knowledge of the epidemiology and their context, what they're doing with their vaccine programs, they more or less, I think, had a similar thinking and approach with respect to, I think you mentioned the pause for those individuals under age 55. Now what's happened, as we've alluded to several times, there was another meeting teleconference that was held on the weekend, and as the province and territories looked at, sort of within their own jurisdictions, looked at their epidemiology, looked at the factors at play, they obviously, as always, the same principle, adjusted their programs to make sort of the best sort of sense on their context, and therefore you are seeing maybe a variation. Certainly, I think the 6 provinces Atlantic, to varying degrees, their epidemiology, I think, in terms of case counts, serious illness, hospitalization, deaths, is different compared to, let's say, the territories up north in the Atlantic region as well. And therefore, that's why you're seeing, I think, adjustments made sort of to get out the vaccines in the best possible way based on the epidemiology. So I think, for example, Quebec, I understand they have a different age cutoff, but I certainly respect the fact that based on their epidemiology, based on their analysis of the factors, this is what makes sense for sort of the Quebec context. And then you can see in Ontario, they've made other adjustments where there's also, besides sort of the age, I think it's 40 plus, that's eligible for AstraZeneca. They're also looking at targeting, I think, maybe putting vaccines or having vaccines available for administration in so-called hot zones and so on. So you can see that the provinces and territories are doing what they believe based on the evidence and the science is really sort of best serving for their context. And I think Canadians hopefully can understand and get that it's hard to have a one-size-fits-all approach. The NACI puts out a broad recommendation, but I think it's more of I would call it a framework. It gives us certain parameters and certain factors to consider that obviously the provinces and territories then take to heart and then apply obviously their own lens and their own context before adjusting the programs as necessary and appropriate for their local situation. Thanks.
Well, thank you, Doctor. Operator, next question. Prochaine question.
Merci. The next question is from Tonda McCharles of the Toronto Star. Please go ahead.
Hi, thanks. I'll be honest, I don't really understand the explanation and the tie-in if NACI was getting information on the severe impact of COVID and variants, what that necessarily has to do with their expected recommendation as to the risk of thrombosis with the vaccines, and I understood that they were going to be weighing in on that. So maybe, perhaps you can take another run at clarifying exactly why they couldn't give the recommendation clearly on the risk of the risk of the thrombotic events associated with the vaccines. And my question around that has to do with apparently there's been an analysis that all of the vaccines, both the mRNA vaccines and the viral vector vaccines, all carry this very rare risk. So I'm wondering if Health Canada is thinking of putting a warning similar to the one that you initially put out on Astrazeneca for all the vaccines.
So sorry, I might have missed the last bit. Just to really clarify, you brought up a very, very good point, which is the risk of the thrombotic event doesn't change. So that is not, it has not changed. It has not changed in the analysis. It is a rare event that occurs 1 in 250,000 to 1 in 100,000, I think is what broadly everyone has been using. Of course, the data could evolve, but that hasn't changed. What changes is what is happening with COVID-19 in your area that balances the risk and benefits, because the vaccine is going to be a very effective tool in reducing severe illness and deaths for sure. And so the benefits of the vaccine absolutely will outweigh the risk of the clotting disorder, particularly in areas of high transmission and high impact. So I'm not sure if that's clear enough, Tonda. Do you want me to?
That helps, yes, thanks.
In your risk,
yep, thank you.
In your risk benefit analysis, yeah. So could you repeat your last part? Sorry about that.
Yeah, so given that there's some suggestion that all the vaccines, all 4, carry this rare risk, have we changed the warnings on all of them?
So I think that there's thrombotic phenomenon that may be different, that needs still be unpacked scientifically. But one other vaccine of interest to Canadians where changes is sort of expected is the Janssen vaccine. Janssen is a viral vector vaccine, very similar to that of AstraZeneca. So that also is a vaccine that Canada expects to be deploying. So Health Canada is aware of the EMA announced label updates that reflect reports of the blood clots with low platelets related to the J&J Janssen vaccine. So they're already reviewing that information and looking at that in our Canadian context. Similar process as they did with the AstraZeneca vaccine, and they'll be working with manufacturers, FDA, EMA, and other international regulators. So then they will take the action if necessary before that vaccine is made available to Canadians. That vaccine hasn't rolled out as yet. And regulators at this time around the world have determined that for that vaccine overall, the benefits outweigh the risks. NACI will make recommendations on the Janssen vaccine. and it will take that information into account, because that statement hasn't been drafted or finalized yet. So that's good, because now they can take into account any new information on the blood clots or low platelets associated with that vaccine. And of course, we will be reviewing any information pertaining to any vaccines, but the Janssen vaccine is of the most interest at this point.
Thanks. And can I just ask quickly? There are a number of doctors who feel that either Canada has already approved I think at least one monoclonal antibody treatment, and yet there are others that are on the regulatory pipeline. And there are a number who feel that that would be really effective right now, especially in places where the hospital systems are really under pressure, and it could take some of the people who are ending up in hospital out of the hospital scene and free up a little bit of capacity. Can you talk to us about that? What is your sense of whether these monoclonal antibody treatments either are available to them and not being used, and if they're not being used, why not?
Yes, I will try and answer that question, and maybe you can follow up with our media relations to get any more details because the treatment side is something that maybe you need to get more information from others and perhaps from the regulator. So we do know that there are these monoclonal antibody treatments available and other treatments as well. So you've provided a very important question, which is that, of course, we've been talking about vaccines, we've been talking about testing, diagnostics. Well, treatment is another area that there's been a lot of work in, and people are pursuing different kinds of treatments. But the most important one, actually, I really feel that changed a lot of the clinical practice is dexamethasone, the steroid that is commonly available to treat patients, was found to actually have a significant benefit, and it's become part of the routine management of patients in the ICU and in hospitals based on clinical judgment, basically. So what is available, I do know, is that tocilizumab is one medication, and it helps like these antibodies to reduce inflammation, some of the significant inflammatory responses as well. And so medication has been purchased and made available to provinces and territories. And not all of them are using this medication to the same extent. And so as I understand it, some of that supply has been shifted to Ontario from a reallocation from other provinces and territories. So that is an example of how that is happening right now.
Thank you, Dr. Tam. We have time for one last question. Dernière question, opérateur.
Merci, thank you. And our last question is from Crystal Og of Global News. Please go ahead.
Hi, Dr. Tam. Thank you for taking my question. We're specifically looking at Ontario here. The ICU numbers are raising, and hospitals have transferred hundreds of patients. Is this something that comes up on your calls with provincial counterparts, and are these conversations about transferring as far away as other provincial ICUs?
It's a subject of intense conversation, I think, both at a political decision-maker level and at the operational level. So with the operations center at the Public Health Agency, as well as public safety and many federal departments, in terms of what offer of support we can provide to Ontario. That is on the healthcare side, so I'm less involved in that. But I know that we're looking at supplies from the NACI, for the National Emergency Strategic Stockpile, that helps ICU patients, whether they be ECMO machines, oxygen concentrators, oxygen supply equipment, and any of the other kinds of equipment they need. But having said that, mobile health units and other measures. What has been requested, I believe, also support for health health workers. So it's not the equipment that is necessarily the rate limiting step. It's that you need teams of people experienced to operate these different types of equipment needed to support someone who's very sick. So I know that discussion is extremely live, and we do have underlying protocols and policies that support mutual aid between provinces and territories. And absolutely, that is a very live part of the discussion with Ontario right now.
Thank you. And as a follow-up, the European Union has turned down 300 million doses of Astrazeneca and Johnson & Johnson. What's your reaction to that decision, and does Canada intend to try and scoop up those doses for ourselves?
I missed the very beginning of your question. Who was giving up?
Oh, sorry. The European Union has turned down about 300 million doses of Astrazeneca and Johnson & Johnson. So my question to you is, what's your reaction to that decision, and does Canada intend to try and scoop up those doses?
So I haven't heard of that. Thank you for that piece of information. I'm not intimately linked to the supply, but all I do know is that every stop is being pulled. Ms. Annan would have spoken about this, and I know she's on the phone and other teams on the phone with European countries, any countries that may have supply. So I'm sure that that is very much part of their strategy, but I don't have any details. Thank you.
Thank you, Dr. Tam. That will conclude today's media update. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.
And that was an update from the Public Health Agency of Canada. You watched it live here on CBC News Network. If you missed some of that, well, CBC's Janice McGregor was listening in, and she joins me live from our nation's capital. Lots of questions about vaccination, about rollout, about timing. Janice, really what stood out for you in all of that?
Yeah, I'm just going to try and go over some important clarifications. I don't know if I'd call them all huge news headlines, but I found them to be very interesting clarifications in this newser. First, if people follow the immunization file closely, you know that we were expecting to hear from the Advisory Committee on Immunizations